This is Dr. Anderson with North Texas Plastic Surgery. I'm talking to you today about blepharoplasty. Blepharoplasty. That's also called a lid lift. Now we can be talking about your upper lids or your lower lids. Patients will come in and they'll frequently ask me, am I the right candidate for this? So most commonly, candidates for lid lift are going to be somebody in their 30s, 40s, or 50s that feel like there's extra skin either around the upper eye or lower eye, sometimes even both. So I will see them and we'll have a consultation. In the consultation, I'll do some physical exam type things to make sure that you're an appropriate candidate, and we'll see where that extra skin is. Sometimes there's extra fat as well that we'll have to address in the operating room, and those are things that we'll discuss during the consultation. Patients then want to know what the surgery is like. Usually surgery for each one is somewhere between an hour to an hour and a half, or maybe around 3 hours if we're going to do both. Surgery is same day, so you'll go home that day as well. You'll get a lot of education from the practice about what to expect day of as far as arriving and immediately after, and then how to take care of yourself after surgery as well. Immediately afterwards, you'll wear some ice packs and take some medications that my nurse will go over with you, and you can expect some swelling and bruising. This generally lasts for a couple of weeks, so I'll always tell patients that if we're doing this surgery for a special event like a child's wedding or a vacation that's coming up, we want to allow at least a month to 6 weeks so that you can be totally recovered and a lot of that swelling has gone down. Then ultimately probably about 3 months till final results. Among the things that patients are concerned about when we're talking about blepharoplasty is how to care for themselves the best afterwards, because patients always want to make sure they're doing everything they can to get the best results. So we're going to accomplish that in several ways. First of all, you'll have a very detailed preoperative appointment at the office where my nurse is going to go over a lot of those things with you. However, people frequently forget those things, and we're always happy to talk about them again after surgery. But some of the most common things are, when can I wear makeup again? For my patients, I usually recommend a 2-week period where we're not wearing any makeup. That allows those incision lines to be fully closed and healed so that we don't have to worry about any sort of infection or anything like that. We'll wait about a month for totally normal activities like going back to the gym and lifting heavy weights, because we don't want to increase the pressure in the area and cause any sort of issues that would delay healing. Another thing that's really important for patients in my practice is we have an app that you can always message us. We're checking it throughout the day and even on the weekends. So if you've forgotten something and you need some reassurance, we're always happy to answer and alleviate any of those fears that happen after surgery. Don't forget to like, subscribe, and comment below.